This week, Bay Area counties are rolling out updated COVID booster shots for children between the ages of 5 and 11. It all comes as a nationwide push to convince all Americans to get their boosters is making little progress. Joining us live now, Dr. Yvonne Maldonado from Stanford. Thank you so much for joining us. Why is it important to make sure kids between ages 5 and 11 get this new vaccine at this point in the pandemic?
Well, as we all know, at this age group and in younger ages as well, this is respiratory virus season, and children are really susceptible to being around others getting infections, respiratory infections, and COVID is no exception. We also know that COVID can be serious. Again, children are less likely to have serious infections than adults are, but they can still get pretty sick. And they can be hospitalized as well. So it is important to keep them protected. If you can keep them out of the hospital, why not?
And what would you say to parents who might be hesitant to get their child vaccinated? It seemed not too long ago everybody was desperate to get their child vaccinated. Now, not so much.
Well, you think about planning for the fall surge. We keep talking about that. And yet, if you look at the numbers of cases and hospitalizations and even deaths right now overall, they're still pretty high relative to the beginning of the pandemic. I think we've just gotten used to this disease. We shouldn't get used to children getting sick. It just doesn't make sense. Now, parents need to bring their concerns and questions to their healthcare providers, because their healthcare provider really has their best interests at heart and can really take the time to answer questions that parents may have about the vaccines.
Now, this new bivalent booster shot is different from the one that we were getting in the summer, and obviously different than the first ones we were getting. Do you anticipate there being a new vaccine that we need to get updated on every 6 months or maybe longer? Do you anticipate that being the case?
Well, as you know, we don't have a crystal ball,
Sure.
but it's possible that we might need to get a booster, say, once a year. We know that immunity for this kind of virus really doesn't last more than, say, 3 to 6 months. But if we can keep enough population immunity up and the variants don't go out of control, we might be able to think about once a year shots like we do with the flu shot. And at some point, this virus might even go away or just turn into a common cold. But that may not happen for a few years to come.
Yeah, I know a lot of kids right now, a lot of moms that I'm friends with, everybody's got the sniffles, and they've been hesitant to go out and get a shot because they're thinking, well, my child already has a little cold. I want to wait till they're totally healthy before I go and give them this shot. What would you tell parents who are concerned about that?
That's a great question. What we tell parents, the same as we do for all the other vaccines, is children can get vaccinated even with sniffles and mild cold symptoms, as long as they don't have a fever, so that they don't complicate an existing febrile illness with an additional vaccination, which might cause a mild fever in and of itself. So it is safe to get vaccinated. It really is important to try to get in as soon as you can, so you don't put it off until the season gets worse.
Yeah, a lot of people are thinking about getting their flu shots too. A lot of folks are concerned about somehow the immune system being overloaded if you get the flu shot and the COVID vaccine on the same day. Any truth to that?
Our immune system is a remarkable thing, as we've learned more and more during COVID, and we are exposed to many different environmental substances, and our immune system is really able to handle them quite well. So there's no concern with giving more than one shot. I think at this point, we know that you get pretty good immunity, even if you get it, for example, with flu or with the other vaccines that children normally get.
Make one appointment with the doctor and get them both done. All right, Dr. Maldonado, thank you so much.